If you are watching this video, this is a buyout debriefing video. It's going to be pretty boring because it's just me and Nicole sitting here and talking. Our buyout days are really intense, and we do a lot of tests during buyout and subsequent to buyout. Generally speaking, these are groups of horses that are in very critically poor condition, and our euthanasia rate is very high. These are some really hard things that we talk about, and a lot of not happy endings. Not all, we still have some of these horses, but prepare to hear some hard stuff. Our intent with this is education and transparency. We want all of our supporters to know how hard our team works to advocate for these horses and how important it is for us to make evidence-based decisions. So that is our goal with this. We're just going to tell you what we saw in each horse, what those diagnostic results were, and where the horse is now.
All right, so the first horse is B25207, who you guys named Ruby. 22-year-old mare quarter horse. She was very skinny, a BCS of 2 out of 9. She had a lot of issues on intake, a 3 out of 6 heart murmur. She had a lot of respiratory issues. She had a Heaves line, increased sounds. She had a pretty loud squeak when she would exhale, was coughing a lot, had tons of nasal discharge. Her mandible was locked, a little bit of redness to her eyes, poor coat quality. Her hooves were overgrown. Her vulva was recessed. We did do some blood work on her, and her hematocrit was 59, which normal is
35-ish, so that indicates severe hemoconcentration. She was very, very dehydrated.
Yep. We did decide to put her out in our pasture and kind of see how she did. A week, so it's been 2 weeks since buyout. So a week after buyout, we brought her in to do some dental x-rays, look at her teeth, and that showed severe dental pathology. She was still coughing the entire week. She was just coughing constantly out in the pasture. You could tell she kind of didn't feel good. We did a cardiac ultrasound and saw that the blood flow in the left ventricle that we were primarily looking at was pretty abnormal. And so we did reduce her teeth a little bit, some of the points that we found, and then afterwards kind of rediscussing her quality of life, everything she had going on. We did decide to provide her with the last act of kindness.
Our next case, our supporter's named Belle. She was 28 years old. She was a little Hackney pony, very cute, very, very thin. She was a little bay. She was very sweet and easy to catch. And she also had some mild nasal discharge. Her upper incisors were completely worn to the gums. She had cataracts in both of her eyes. She had a club hoof in her right front. And she just had a very poor muscle and body condition score. Unfortunately, when she came in, this is the little one that was colicky. Mm-hmm. So you'll have to forgive us, especially me, as I'm going through. I remember things and then I talk too much about things. But this little pony came in. We already were very concerned about her dental health. She had severe dental pathology, but she also started showing signs of colic. So I had sedated her just a teeny tiny bit because to get accurate dental films, they have to not move their head at all. And she was flank watching after that, and she kept laying down and getting back up. And I thought maybe she's just really exhausted and sedated, but our staff remembered that she'd been laying down before that. So she was exhibiting signs of colic and did not respond to pain medication for that and continued to progress with those symptoms. And so she was given the last act of kindness and a lot of treats, which she was still willing to eat, even though she was showing colic signs.
And we say this every time. If we don't say they got pain meds, but we mention that they were painful, anybody that shows any signs of pain is given pain meds right away.
And if you watch our actual videos of buyout day, we kind of triage so that anything that's acutely painful gets pain medications really quickly. And often that's verbal communication. Did that horse get pain meds? Yes, I gave them to him. So our team is really careful, but I don't always elaborate on that. So yeah, we don't let things sit around and be painful without medicating them.
B25209, his name's Snowman. An Arabian gelding, was about 25. He was gray, also very skinny, 2 out of 9. Had a heart murmur of a 2 out of 6. Increased lung sounds, nasal discharge. Was quitting and the jaw was locked.
You want to explain what quitting is?
Oh, I'm going to let you do it.
Yeah, okay. Quitting, Quidding, is a term for balling up ingesta kind of in the cheeks and dropping it in a little chunk of kind of partially chewed ingesta. It's an indication of more advanced dental disease.
He also had a lot of masses under his tail, which our first concern with that is going to be melanoma. Very poor coat, very poor body condition, muscle condition. Hooves were overgrown. He was a little bit off in his left hind. When we watched him walk around, he had some pelvic asymmetry and was kind of toe dragging a little bit. We ultimately, between the severe dental pathology, respiratory issues, and the melanoma, had provided him with the last act of kindness.
B25210, this is the perfect name for this little mare, is a little POA mare, little Appaloosa pony. She's about 15. Our supporters named her Nutmeg. She's very saucy. She did not appreciate being handled. We have her down for a pregnancy check and an ophthalmic exam. That is mostly because I wasn't able to get close to her face during exam. She was very, very hesitant to people. Her heart rate was 56, which is elevated. However, she was very nervous and high alert on intake. And overall, she's got a great body condition score. She had some overgrown feet, but there were no other concerns. She's lame at the walk and trot. So she received some vaccines and a microchip, and she's been turned out to decompress. And unfortunately, this is pretty common if we have horses that don't have physical health concerns show up. Often they'll have behavioral concerns because people have not been kind to them. So hopefully we'll be able to win Nutmeg over.
And she's not lame at a walk. I feel like you said she is lame.
Oh, she's not.
I don't know if you did. Maybe that's just what I heard.
She is not.
She
we
looks
have
pretty good.
No major health concerns with her.
Oh, I keep getting these ones. B25211, named Pumpkin. She was a cute little Arabian cross filly. She was only 3, chestnut. She looked really good. She had a little bit of redness to her eyes, a little bit of discharge, some nasal discharge, and a little bit of increased lung sounds. Body-wise, she looked great. We gave her all of her things, her vaccines and stuff, put her out in pasture.
B25212, her name is Taha. She is about 18 years old, also very thin. We body condition scored her at a 3 out of 9. She was, I love these forms, right? I did this exam and I circled both dull, depressed, and high alert. So this horse was both feeling bad, but also high alert. She was nervous, but once you touched her, she calmed down. And she did have nasal discharge that I described as profuse, thick, and yellow. Her lymph nodes were within normal limits. She seemed to have normal vision, although she had redness and discharge from both of her eyes. Her hooves were really overgrown. She had left and right front legs had really severely bowed tendons, but I documented that they were cold to the touch, which means it probably happened a long time ago that she had a soft tissue injury to that leg. She did also have some pain on palpation of her withers, but she was mostly sound at a walk, and she didn't have any evidence of mammary development. We took radiographs of her withers and didn't see any major issues. She has a little bit of osteoarthritis, especially in her right front pastern, but it was very mild. And her lameness eval at a walk showed soundness. She had a little bit of mineralization in her nuchal ligament of her neck, which indicates some chronic inflammation, but overall she seems comfortable. So she is turned out in a intake pasture to decompress. She also cultured a bunch of gross bacteria, 5 5 different bacteria, but none of them were of major public health concern.
B25 213, little Liam. He's a 2-year-old colt quarter horse, little chestnut. He looked really good. He had some warts all over his muzzle, but
Papillomavirus.
yeah, other than that, heart and lungs sounded good. Lymph nodes were normal. GI, eyes, everything sounded a walk. He looked great out of everybody. So he is hanging out in his pasture, and we have him set to get castrated pretty soon.
B25 214 is a yearling filly. Our supporters named her Bella. She's very cute. She is not as thin as the others, so her body condition score is 4 out of 9, which is close to where we want it to be. She's a little chestnut. She is sweet and halter trained, and she was bright, alert, and responsive when we examined her. Little bit of an elevated temperature, but buyout days are really stressful, and her heart rate and respiratory rate were normal. She did have a little bit of some serous nasal discharge. Staph and strep species. You would think I would remember this, but I don't trust my memory on stuff. She had a small wound on her medial right front leg that's already doing way better. She had a little bit of hoof overgrowth, but she's sound at a walk. She has a pretty sizable body wall hernia right at the level of the umbilicus. I did not palpate small intestine, so that's important because when the small intestine comes through a hernia, it can twist on itself and cause a strangulation, and that can be a surgical emergency. So what I felt in hers was mostly just fluid, which does confirm that there's a hole where there shouldn't be a hole, but it is a surgery we've done a couple times at Horse Plus, and one of the few abdominal surgeries that I'm willing to tackle. So we have her down for hernia surgery. We gave her a couple weeks to rest up so that she's a little bit better of a candidate, but we are going to do that surgery sooner than later. Oh, this guy.
Okay, B25 215, named Phoenix, was a little gray donkey. He was a little stallion. We aged him around 32 or older. If you watch the buyout video, he is a hard one. As soon as the trailer opened, he was down right at the back, and there was 3 to 4 big horses standing right there ready to back up. We tried to get them to not back up.
Yeah.
And that didn't work. And you will see him get stepped on right on the chest. It was very hard to watch.
Horse Plus does not have any jurisdiction over what we receive in these buyouts or the manner in which they are transported. So if you watch and you're horrified, we are also horrified. Mm-hmm. We are literally diverting slaughter trucks that are headed for a slaughter yard, and it is inappropriate to transport a much smaller animal amongst bigger animals. It's horrible.
Yeah. And so, he was really little.
He was very
a
small.
Tiny guy.
So if you watch the videos, please do not assume that Horse Plus chose to load those animals and unload them in that manner. We have no control over that. And we didn't know where he was.
We just knew he was down.
Opened the door.
Yeah. So if you watch that, you'll see, I think, at least 1 or 2 of the horses come off stepping on him. And then I believe it was Tawny just risked it and went in and grabbed him to get him out of the way. It is obviously super dangerous to try and just go up when you're at the butt of 4 horses who are probably terrified after just being transported. So he got him off, pulled him to the side, immediate pain meds, an evaluation. His gums were white and tacky. Couldn't hear his heart because of severe crackles. Mm-hmm. His lungs sounded terrible, crackles and wheezes. His coat was covered, scar and wounds. Overall, he just looked absolutely horrible. He couldn't stand.
Heart rate was in the 70s, but I couldn't really.
Yeah, respiratory rate in the 40s. Couldn't bear weight, especially on his right hind. As soon as we realized that he was in that bad of shape, he was provided the last act of kindness right away. And we did post-mortem x-rays to see what was going on with that hip, and it was fractured. It looks like at the femoral head.
The hip and the head of the femur, yeah.
So both, and they were pretty old. So he had been like that for a very long time. Ugh. Yeah. He was a hard one to watch. That's the first time I've looked away from horses getting off the trailer. As soon as he got stepped on.
This one
rough.
was also really, really difficult. So our next horse is B25-216. Our supporters named him Buck. He was at least 26 years old. He was a beautiful Palomino stallion. He was a Tennessee walking horse, and he did have a cut tail tendon, which I didn't notice right off the bat. He had horrible, horrible looking hind legs that were just saggy and flapping at the level of the lower joints. I mean, my 5-year-old could look at him and say, that horse hurts and his legs aren't normal. It was really difficult to watch. We moved him as little as possible. He did immediately receive pain medication. His heart rate after pain medication was 60, and he was calm when I took that. So upper end of normal for horses is in the 30s. 60 indicates severe pain, and because horses are prey animals, they hide that well. But this poor guy, he was in horrible shape. He was given the last act of kindness before we did any diagnostics. We moved him as little as possible.
Yeah.
And after he passed, I did more of an exam, and that's when we discovered that he had a cut tail tendon, which I now know because someone else told me that other industries also cut those tail tendons. I thought it was just the big lick horses, so that was my own ignorance. That there are other gated horse show communities that do that, which in my opinion is unethical. But his radiographs are just absolutely horrific. There's just giant chunks of moth-eaten bone in both of his legs. And I'm not a radiologist, so my differentials were either old fractures of both of those joints or severe osteoarthritis or neoplasia. So sometimes certain types of bone cancer can make kind of like a fluffy moth-eaten appearance. But it was really horrific. And this guy at 26, the only explanation I have for someone allowing him to go through that is that he was beautiful. He was a beautiful color. He had a great personality. And I suspect that somebody kept breeding him until he was physically unable to do that anymore. And then they checked him in a slaughter auction. Really unfair to him.
B25-217. He was named Captain, a 35-year-old gelding Appaloosa. He was very quiet but alert. Halter broke, very, very sweet. After pain medication, his heart rate was still 66. So we bumped it up a little bit and gave him a little bit stronger of a pain medication, and that still only brought it down to 64. He was blind in both eyes, and you could tell that they were very painful. Had a large wound right across the leg that pretty much, you said you
transected. You could see the bone.
You could see the bone in it. And was pretty much dragging that left front leg where that wound was. It had a huge pocket in it and everything, discharge. We also suspected that he probably had some dental disease. And just with the way that leg was, that alone, we would have provided the last act of kindness, but then on top of it with both the painful eyes. So he was also given the last act of kindness very, very early on.
Super sweet.
Yeah.
Old man. B25-218 was a 2-year-old filly named Barbie. She was gorgeous. She was a Palomino with a blaze, and she was dragging her left hind leg that was just kind of knuckled over. She seemed really calm, but her resting heart rate after pain medication, the lowest it went was 56. So you'll hear us talk about heart rate a lot. Heart rate is significant in most species, but in horses, it's one of our best indicators of whether or not pain is controlled. So she was dragging that left hind and was essentially non-weight bearing. So she had it on the ground, but she wasn't holding any weight on it. And so the differentials for that include something congenital. You know, if she just had a club hoof, there are some surgeries that we can employ to help correct that angle. But unfortunately, in her case, her nerve function was damaged in the whole leg. So she was unable to pick up, move, or place her leg. Her proprioception, which is, does the brain know where the leg is in space, was a complete failure. Mm-hmm. So there's nothing that I or any veterinarian can do to restore nerve, or any human doctor. Once you're paralyzed, you're paralyzed. I couldn't restore function to that leg, and horses, I don't want to go into, prosthetic limbs. Horses, generally speaking, do not do well when they are unable to use all 4 of their legs. They can compensate to a degree, but usually, eventually, sometimes very short term, sometimes after just a couple months, best case scenario, a couple years, they start to have failure of the support limb, which is the remaining limb that's left carrying all of that weight. And it's just absolutely heartbreaking to have to make a call on a horse this young, but I did. I did not think her quality of life was good. Her pain was not well controlled, and she was given the last act of kindness.
B25-219, we have little Lulu. She is a roughly 5-year-old mini mule. She's super cute. She's bright, alert, didn't love being handled. We did have to use our little chute for her. She was very hard to catch. She had severe overgrowth to the point that her both back feet were fully slippered. Mm-hmm. And then the fronts, her left front, she was walking basically on the front of her pastern. And then her right one was also pretty bent over. And she had club hooves on all 4. That was pretty much her only issue, which sounds like a lot. And as a team, she was one where we discussed it for quite a while to decide if we were going to try and tackle her feet and see if we could get her through it. We did do x-rays to see if there was any rotation, and it didn't look like there was. If there had been rotation, then we would have made a call at that point. But given that it looked like just severe hoof overgrowth, we are lucky right now that we have a gentleman here who also does farrier work. So we had him come look, see if it was something he thought he could tackle. It was pretty much going to be like a one and done, see how much he could get done and see how she did. Because we had to fully anesthetize her in order to do her feet. So we can't do that on a regular basis. That's not fair to her.
For her sake.
Yeah. And so he wanted to give it a shot. We decided it was worth it since she was only 5, and she otherwise looked pretty healthy. So normally we do not do full anesthesia during buyout because buyout is hectic enough.
Yes.
That was one of my negatives, was now we have a horse under full anesthesia we need to monitor.
But we also couldn't wait. There was no letting her walk around with it.
Yeah. So we went for it. He got a ton of that excess hoof off. We got her into one of our little smaller pastures where we can kind of keep an eye on her, and we know we're not going to have to chase her around to try and get her back into the barn. After about a week, so she's been on daily pain meds. It took about a week, but she is walking much more normal, looks more comfortable. She's starting to come around, is a little bit more curious about people and snacks. So our training staff is going to start working with her a little bit more, get her comfortable with the halter, and try and start getting her to let us pick her feet up so that we can keep working on her feet and see how she does. But right now she's looking pretty good. So
B25-220, Romeo. Do you ever meet those animals that just speak into your soul? This horse.
He was telling her something.
I'm going to try not to be emotional.
This
is just, it's hard to kind of relive these cases. This horse was very, very thin. He was very sweet. He clearly had chronic diarrhea, just straight watery diarrhea. And his heart rate was pretty normal. It was 36. He did have some nasal discharge. He had really poor quality coat, overgrown hooves. He wasn't lame. He didn't have pain on palpation, but he just came in and was like, hey, I felt like he was trying to tell me something. We ran some blood work, and we found that he had some severe abnormalities in creatinine kinase, which indicates muscle damage. He also had elevated liver values. So 2 of his liver values, AST and GGT, were both elevated. He had signs of infection somewhere. He had elevated white blood cells, and he had some pretty significant anemia and really low platelets. So we went, okay, something really significant is going on. And So that was day 2, and then we rechecked him, and we knew that his mouth was likely a problem. Often diarrhea is related to dental disease. And we sedated him to do a dental and found that he physically could not open his mouth. If you've seen our dental speculum, it's a machine that opens horses' mouths. And obviously we would never crank an animal's mouth open forcibly, but he was physically unable, even with sedation and pain medication on board, to open his mouth more than I literally was shining a flashlight in trying to see. But we were able to take radiographs and document severe dental disease. He had a hook wave mouth. He had a bunch of furcations, which is when the tooth is so loose that you can see the little U shape where the roots are attached up in the jaw. And then he had a bunch of fractured and missing teeth. Even though his heart rate was normal, his mouth had to have been so painful. And he was just a walking skeleton because he couldn't open his mouth. And I would not have been able to fix the degree of pathology in his teeth. But in addition, he had major organ dysfunction and a lot of other things going on. And we gave him the last act of kindness.
B25 to 21, supporter's named Luna. She is a beautiful white mare. She's about 20. She is blind in both eyes, but seems very well adjusted to it. They don't seem painful. She was very easy to catch, halter broken, super sweet and calm. Had some nasal discharge, a couple small wounds on her face, which is pretty common with blind horses, even that are adjusted. But with being bounced around, she was probably running into a lot of stuff, learning new areas. Had some rain rot, no pain on palpation of her back. Everything else looked pretty normal. Her blood work did show elevated CK and increased AST, but we decided to rerun blood work after a week and everything looked much better, way more normal. So that was good. So she is out in one of our big pastures with a couple buddies. We have her down to have both eyes removed because even though she is not painful right now, eventually with how her eyes are, they will become painful. So the best thing for her, just like Blackberry, is to take both of them out. We have her down for that, and hopefully we'll be doing that about next week. And we brought her in last week to do dental radiographs and a dental. I'm going to let you explain this because this was the first time I had seen this since we gotten here. So Dr. Lydia was explaining it to me.
Yeah, so I want to be careful and respectful in what I say about lay dentistry. A lay dentist is someone who does not have a professional degree, but who does dentistry, which feels like it should be illegal. In a lot of states, it's not. And I actually do know of lay dentists in states where it's legal who do an amazing job. So I don't want to, across the board, say never let someone who's not a veterinarian work on your horse's teeth. However, the potential to do a lot of harm is there. And these people should not have access to sedation drugs. So I always sedate horses to adequately examine their teeth, and especially if I have to do any dental work, even a little bit. It's literally a drill that you're filing down bits of teeth, so it's distressing to the animal. It can be unpleasant, it can be uncomfortable, and so to me, just the sedation part means you really should only have a veterinarian with the appropriate specialized equipment. But this horse had super severe hooks in the front teeth. I mean, they were like inches too long. But then her back teeth on multiple arcades had been rasped smooth. So horses should have undulations in their teeth. That's the grinding surface. And you can cause cavities. You can cause fractures in the teeth. You can permanently damage teeth by filing them down too much. You wouldn't think that would be doable, but it's doable. And so this mare has like just smooth sloped surfaces in both sides of her mouth that it's speculation, right? But to me, it is consistent with someone going, oh, this horse was dropping feed because she had dental problems, but the teeth that were causing the problems weren't addressed. and the other teeth that likely were not causing the problems were overfloated. So, and I couldn't, like, I took radiographs and went, this is so weird. Why does this horse's mouth look like this? And it wasn't until I had her sedated with the speculum and then the headlamp in, and I put my hand in and I went, oh, she has no surfaces. So just a little tale of caution. If your veterinarian quotes you, you know, a couple $100 to do your horse's teeth, you could be saving your horse's life by having somebody who's adequately trained and has the right equipment to do that. So Obsidian, B25222, is a 25-year-old standard-bred gelding. He is very thin. He is black. He is halter trained and easy to catch. And his physical exam was largely normal, except his left front carpus, which kind of looks like the knee, is very big. So probably this much of the joint just has this big, firm swelling on it. He is sound at a walk, and we did not ask him to do anything other than walk. But on radiographs, he has this large moth-eaten area of what could be bone. It could be a tumor. I'm not sure what it is. Our radiologist is going to review it. It is very abnormal. I wrote hospice ? Because if it is a tumor, but he's comfortable right now, maybe we could give him some comfortable time. Maybe it's something I've never seen related to an old injury that's not going to cause him any subsequent problems and he doesn't need a hospice type home. I'm not sure, but at the time being, he is very comfortable and he is turned out in one of our pastures to decompress.
B25223, Alfie. He is an 8-year-old gelding quarter horse, a little chestnut, very, very skinny. We BCS'd him at about a 1 to 2 out of 9. But super sweet, was easy to catch. Overall, most things checked out. Lungs, heart, lymph nodes, eyes. But he has horrible conformation, and his left hind leg looks very swollen. It's just very upright. He's a little bit unsteady, but proprioception was normal. Radiographs just showed poor conformation. He's just very crooked.
Things are not lined up the way they should be lined up.
Yeah.
Really anywhere.
Yeah. But
poor backyard breeding.
He is also otherwise healthy, and so he was one that we were going to let him hang out for a while, kind of reassess his legs and see.
Please come adopt beautiful lemons that can only live as horses and eat
grass.
He's
very cute.
I don't think Alfie will ever have a job.
Yeah.
Maybe.
But if you want a really cute young pasture pet.
Our next horse, B25224, our supporter's named Alaska. He was a beautiful 28-year-old quarter horse gelding. He was very thin. He was white, and he was easy to catch, halter trained, so many melanomas. He also had DSLD, deep suspensory limb desmitis. In both hind legs, the left hind was worse than the right. He had a grade 4 out of 6 heart murmur, mostly on the left, but you could hear it on both sides. He had a mass on his mandible that I estimated to be about 4 inches by 5 inches. He had 20 to 30 masses under his tail and on and inside his anus. And then he had large masses at the commissures of his lips, which you couldn't tell right away, except that anytime you went to touch his face, his mouth was so painful and you could feel them inside his mouth. So he had masses extending into his mouth. He had cataracts in both eyes. He had really bad rain rot and was just in very poor condition. His hooves were overgrown. He had some pain on palpation of his spine. He was lame in his left hind leg, and he had a very painful mouth. Almost with 100% certainty, a white horse with masses of the appearance and characteristics that were present on this horse. I feel very comfortable saying that he had melanoma, which is a malignant type of cancer. Even if they were benign, they were ulcerated and causing him discomfort, both with eating, but also with defecating and probably some other things in between.
B25225, Maple. She is a quarter horse mare, about 24. She was a dark chestnut. Let's see. She was very sweet, but a little bit nervous. She didn't like her mouth touched, so we did some dental x-rays. There was a possible fistula into the nasal cavity, multiple fractured teeth. She also had kissing spine because we did back x-rays because she was painful on palpation. She was a little bit short-strided in the left hind, but with the kissing spine and such severe dental pathology.
She also had arthritis and a bunch of other vertebrae.
Yep. We provided her with the last act of kindness.
You can't tell with your hands how bad something is. And this mare is one that you easily could have gone, oh, let's get her a chiropractic adjustment and some Butte. And she clearly had been worked with. She was probably trained to ride. If you don't have the ability to do the diagnostics, you have no idea. And this mare's back was horrifically bad. And she had to have been so painful from it. So it's being able to see in a black, it's not always black and white, but being able to go, yeah, we're not going to ask this animal to undergo another day of discomfort is really, I'm so thankful for diagnostics.
Well, and animals are inherently good at covering up pain. And I mean, we've had horses that we thought were super healthy and super great and then did, just some preventative x-rays just to cover all our bases and then found out how bad their joints were. So
yeah,
it's worth the money.
For sure. B25226 is named Twilight. She's a 16-year-old standardbred mare. She is bay, and she has a brand on her right neck, 7G136. I'm sure we can look her up. She probably has a name. She has scarring over her withers and the lateral aspect of her right stifle, so she probably had some type of career-ending injury. She is halter trained and a little pushy. It's funny how many standardbreds are like, I'm going to walk all over you. And when you're like, no, you can't, then they're like, okay, fine. Her temperature, pulse, and respirations were normal. Her GI sounds were normal. She had a little wound near her eye that is already looking great. Her hooves are a little overgrown, no pain on palpation anywhere. She's a little short-strided in the left hind, but she wasn't lame. So anytime we have a change in stride length, we note it. We don't really have time to do thorough lameness exams on intake days. So it's a very precursory, is this animal comfortable? Can we turn them out? She had a lot of scarring associated with her external vulva and into her vagina. So I suspect that she may have been used as a broodmare and had a dystocia, but nothing that looked painful or active right now. So she is down for a pregnancy check, a dental, and to see our farrier, but she got turned out to decompress.
B25227 is named Dixie, an 8-year-old saddlebred mare, bay. BCS of 2 out of 9, so also very, very thin. Heart rate was 56, but she was very nervous. Heart and lungs sounded good. Lymph nodes were good. Her coat quality looked like she had some rain rot and was a little bit neglected. Severe cracks and overgrowth of the hooves. But on her lameness exam that we did, she was very lame in the left hind, had severe atrophy of the left hind and some pelvic asymmetry. Did we do x-rays on her?
We did. I couldn't find, I suspected that she had an old pelvic fracture and she had some really weird vertebrae, but I couldn't find. Taking x-rays of the pelvis of a horse is
really hard.
Is challenging because of the complicated anatomy, but also the density.
Yeah. But when you looked at her from behind, her hips were like this.
It kind of would have been, it was kind of impossible based on how her body was holding the pelvis for the pelvis not to have been fractured, but I did not document a pelvic fracture, so I just wrote suspected. But she was dragging that leg.
So because of that, we did provide her with the last act of kindness. B25228, Cooper, a little 3-year-old quarter horse colt. He is bright and alert, was a little bit hard to catch, but we were able to get a halter on him. He had a fractured jaw, so he had a big swelling, and so we did some dental x-rays and found a fracture in the right mandible. It looked like it was at least a couple weeks old, but was healing. And so everything else looked good. He had at least... She wrote at least one testicle pregnant.
Instead of present. I was probably talking.
He was the last one of the day, so
I'm
we retired.
confident that he's not pregnant.
So he has at least one testicle. He is not pregnant. We had him down. We put him in one of our smaller pastures by himself so that we could monitor to make sure that he could eat, because that was our biggest concern with that fracture. And day one, he ate just fine. So he was on pain meds for a week. And then we took him off, and he has been doing great. And so we have him down for a castration. And when we do that next week, we're also going to retake those x-rays of his jaw to see how that's healing. He looks good. So hopefully we will be able to find that other testicle and that he's not a cryptorchid, and that his
might just need a little
jaw
bit
is
more
good.
time.
Yeah.
The great thing about
Well, he is 3.
the fracture in this horse, for one thing, it wasn't both sides. So because of the way the jaw is structured, the fact that this side is fine means that there's enough stability on this side that we didn't have to go in surgically and put a plate or wires or anything in. But also the tooth roots of a horse go pretty deep into the mandible. And as best as I can tell, it doesn't seem like any of his teeth were affected, which is awesome. So he probably just got kicked, and we're hopeful that he'll make a full recovery. I think he's going to have a big scar on his jaw right here, but that'll probably just be cosmetic.
Yeah. And that's all of them.
Buyout days are tough, but we're really thankful that these horses did not end up riding in a trailer for days, sometimes weeks. Sometimes these buyers go to different auctions and offload and unload horses if he doesn't think he's going to make enough of a profit. So certainly the ones that we have to say goodbye to are hard, but I'm always thankful that they don't have to undergo any more suffering that they already have.
The horses we rescue out of the horse slaughter pipeline are in some of the worst conditions I've ever seen. And that led on to an investigation of what's really happening. You know, why are these horses so skinny? Why are there such strange injuries? Why do they have diphtheria? And it all led back to the reality that a criminal organization is using the horse slaughter pipeline as a front. And the horses that we're getting through the buyout are often horses that have gone through this torture. And they come to us when basically they want to get the last bit of money they can on these horses. I have done a video, and there's a link in the description of this video about what's happening within the horse slaughter pipeline, the true reality of it. Every horse we rescue has its own unique story. Some of them are old, some of them are very young. They all have something in common though. They were rescued out of the slaughter pipeline. And for those horses that come to us so broken we can't fix them, their lives are not in vain that they came to us. We're able to document their conditions. They help us with an ongoing investigation. And some of these horses, for the first time in years, they finally get pain medicine, and you can see the peace that comes over their eyes that they're no longer suffering. So for those horses we do have to say goodbye to, their lives are not in vain. At the very end, they got loving, compassionate care, and they knew that it was okay in the end. We need support to help end the brutal slaughter pipeline, the slaughter itself. The SAFE Act would end that. And you can go to Horse Plus Legislative Coalition and learn how to join, how to find out how you can help, and we will keep you up to date on the legislative level that we're working on to prevent this torture happening to horses. We are so incredibly grateful for everyone who donates to help us rescue horses out of the slaughter pipeline through the buyout programs or auction rescues. Your support is crucial, and we couldn't do this without you. And we're thankful that for every horse that came to us, we were able to give that horse the help it needed, whether that was the last act of kindness or rehab so it can go on to find a wonderful home. Support the SAFE Act. Call your representative. Tell them that horse slaughter needs to end and ask them to support the SAFE Act. On a legislative level, that's what we're working on to end horse slaughter. But most importantly, there are victims in the slaughter pipeline right now that need help. Your support can help us save them. So please make a donation to Horse Plus Humane Society and help us save these beautiful animals when everyone else has walked away from them.